everyone, we'll be discussing our presentation as Tele-ABA versus In Home-ABA. Our presenters are Carrie Brewer, Natalia Burgos, and myself, Jennifer Gibbons. Due to our smaller group sizes, we opted to do an informal debate as we felt it was more conversational. As for roles, due to our smaller group size, we took multiple roles. Carrie Brewer was a researcher, illustrator, debater of pros in Tele-ABA. Natalia Burgos was a researcher, illustrator, debater, and is arguing for the cons of Tele-ABA. Myself, I'm the introducer, illustrator, summarizer, researcher, and fielder for the presentation. There's some background information about autism. The Center for Disease Control and Prevention has estimated there's about 168 children currently identified as having ASD in the US. And this chart just helps put that in perspective as we become more knowledgeable about how ASD influences people. We've been able to look at more into it, and this shows how the prevalence has gone up throughout the years. Overall, treatment for anyone with ASD can be very costly. The cost per year for a child with ASD is about $11.5 billion to $60.9 billion from about 2011, according to the Center for Control and Disease Prevention. In 2005, the average medical cost for Medicaid enrolled children with ASD was $10,709, which is 6 times greater than those without ASD. And intensive behavioral interventions can be extremely expensive for families, with the cost ranging from around $40,000 a year to $60,000 a year. There's a huge need for ABA currently. In 2014, there are more than 3,000 individual postings for behavioral analysts nationwide. There have been an increase in demand for credentialed behavioral analysts. The total postings have doubled since 2012 from 1,414 to 3,083. And this is according to the Brain Glass report, which is on the ABA website. This is just another chart to help put that in perspective, that as the prevalence of autism has increased in the US, so has the need for those with their BCAB certification to properly give the treatment to individuals that need it. So what we'll be going over for our presentation is, first we have a couple videos just to help give a perspective of both Tele-ABA as well as in-home therapy. And then I'm going to introduce all the ethical codes, and then I'll hand it over to Natalia and Carrie, who will discuss the pros and cons of service delivery, transfer of information, outcomes for parents and guardians, and efficacy of treatment for.
Many families seeking help from autism specialists experience long wait times, often more than 1 year. Travel costs for families who live in rural areas add to the complications of receiving care. Now, researchers at the University of Missouri's Thompson Center for Autism and Neurodevelopmental Disorders are preparing to expand ECHO-Autism, a successful training program that assists primary care providers in rural areas in diagnosing and managing autism. Launched in 2015, ECHO-Autism uses video conferencing technology to connect physicians in rural areas to a panel of autism experts.
One of the most important things about ECHO is it uses the opportunity to move knowledge rather than moving patients. So for years, families or patients would have to come to an academic center in order to get the best practice healthcare. But what ECHO and ECHO framework is able to do is actually move that knowledge, move the specialist knowledge to the community and help to enrich and mentor community practitioners.
Initial studies found that care providers who use ECHO-Autism had more confidence when identifying, assessing, and treating conditions related to autism. One parent of a child with autism says this program is beneficial to rural families because it connects them with experts and involves doctors they know and trust.
So I had all of these questions with no answers, and going to the internet wasn't fruitful at all because you had conflicting stories. I think the scariest part of not having answers is all the unknowns, and reaching out to someone like a primary care physician who knows your family and knows you and is able to answer questions and guide you through the process is really important.
Sol and the Echo Autism team have trained nearly 250 physicians in rural Missouri and other areas. They are currently preparing to expand the program to Alabama, Alaska, underserved Navajo communities in New Mexico and Arizona, and globally through partner sites in Kenya and Uruguay. For the MU News Bureau, I'm Jamie Crockett.
Meet Christopher, a budding musician who loves to play piano and sing. This year, he made all-state chorus and earned straight A's. Those are big accomplishments for any teen, but for Christopher, they're even more impressive. That's because Christopher has autism.
Off to New Manchester High School. It's a fine arts music education program. I'll be singing and dancing, and it'll be a lot of fun. I could be in plays. It will be lots of fun there.
Christopher is flourishing and has a loving and supportive family. But when he was first diagnosed, his future looked uncertain and bleak. His mom, Stacy, says her son was in his own world.
In the beginning, you feel like, what did I do? God, what did I do? Did I do something wrong? Is there something that I wasn't living right or something? What am I gonna do?
Stacy and her husband, Mark, moved quickly to help 2-year-old Christopher. He began working with Dr. Kobe Lunt, who specializes in applied behavior analysis, or ABA.
We taught him a lot in those first couple of years, so it's pretty amazing to see him now as a kid who just graduated from middle school, who is basically acquiring all the skills that we equipped him to acquire on his own.
Dr. Lunt attributes Christopher's success to early and intensive intervention using ABA. He and his wife Janet founded Integrated Behavioral Solutions in 2000 and have helped many kids like Christopher learn how to interact with the world around them.
The differences that you can make in developmental disabilities tend to be huge.
When I found that there was a science that taught me how to change behavior, that just opens up a whole world. And so the idea of spending my time trying to improve the lives of someone else was amazingly gratifying.
A team from Integrated Behavioral Solutions worked with Christopher through 4th grade, often spending 30 hours per week teaching him and his supportive family in his natural environment.
We had a therapist pretty much everywhere we went, every day. If we went to the mall, if we went to McDonald's, wherever we went to the zoo, we went to Imagine It, we took a therapist with us.
Both the Lunds and Stacy urge parents of children with autism to investigate applied behavior analysis as soon as possible after diagnosis.
That's one of the amazing things about working in autism. If you have early intervention, intensive intervention, then as many as 1/3 of those children can end up indistinguishable from peers.
I like to say thanks for all their help they did to me.
Parents seeking help are often confronted by an overwhelming array of options, many of which are unproven or even potentially harmful. The Lunds encourage parents of autistic children to consider evidence-based interventions such as ABA, which has a rich history of treatment effectiveness dating back to the 1960s.
I think it's a commitment for anyone, but it's one that what research study after research study and parent after parent after parent will tell you it's an investment that's well worth your time, because you just meet Christopher and you kind of say, yep, that's worth it.
You know, if somebody said, we'll trade you this normal, typical child, and it would, no, because I have something special that you don't have. I have a miracle. I have a miracle. So I wouldn't have had the miracle without IBS, bottom line.
So the first ethics code I'm going to introduce is ethics code 2.01, which involves accepting clients. I'm going to summarize all the ethical codes due to the length of some of them. Feel free to pause the video if you feel the need to read through them at all. And all the codes are from the Behavior Professional and Ethical Compliance Code for Behavior Analysts. So accepting clients the code involves that behavior analysts should only take up a client if they are well educated and prepared for the services that the client may require. If they are not as well informed about different services, behavior analysts can work under a supervisor who can help guide them to ensure that programs are conducted properly. This helps ensure that the clients are getting the treatment that they require. The next ethics code is a huge basis of ABA, which is episode 1.01, Reliance on Scientific Knowledge. Overall, this is that behavior analysts conduct services based on prior scientific knowledge, as well as data when working with clients, which goes over the underlying factor that we are a science-based field, and that everything we do, we take data on so we can help find ways to help our clients work through different skills. 2.06 involves maintaining confidentiality. Overall, this code means that behavior analysts must protect their clients' personal information at all costs. It's important to use minimal information that may intrude one's privacy. For example, the employer I work for, we only speak with the clients' names with a code that we have provided for them to help secure their information. Confidential information should only be spoken about when necessary persons clearly are concerned with what matters for the client. No information about clients should be shared on social media, for example, sharing pictures that may be used for an individual's picture ID program. Our next one involves 2.09, treatment and intervention efficacy, which overall means that clients have the right for effective treatment based on prior research and with the client's needs. Behavior analysts have a right to advocate for their clients when needed in order for the client to meet his or her goals. Data is taken to ensure that programs or behavioral interventions are effective for the client and their success. Our next one is 1.05, which involves the professional and scientific relationships. Overall, we are professionals in this field, and it's important to remember when working with clients, language must be used in terms that are understandable to the client and their family. If there's any language barrier at all, proper referrals should be made in order to make sure everyone can understand the client's progress. Behavioral analysts should avoid discriminations, and services should only be provided when personal conflicts do not affect services to the client, which other words means that if you have something going on in your personal life, leave it at the door when you go in to work with a client. Code 2.07 involves maintaining records, which essentially means that necessary precautions are always taken when handling data and records to keep information confidential. Records are disposed of appropriately and in accordance with different laws and policies, especially this code with the professional and ethical compliance code for behavior analysts. 3.01 involves the behavior analytic assessment, which refers to the fact that proper assessments are conducted when creating or altering any programs, including behavior induction program. They must first conduct a functional assessment, and data should always be graphed using analytic conventions in order to be able to show if a behavior is effective or not. Code 4.09, which is least restrictive procedures, just simply means that behavior analysts review and appraise the restrictiveness of procedures and always recommend the least restrictive procedures likely to be effective. Code 5.03 involves supervisory delegation, which means that responsibilities given to behavioral analysts are only programs that can be competent and ethically and safely provided to a client. If supervisors do not have the proper education, they will provide conditions for the acquisition of these skills to individuals working on a client's team. And then 5.04, designing effective supervision and training, means that individuals working with clients make sure that all programs are ethical and that individuals working with clients are under proper supervision and are trained before working directly with the client, which helps ensure that the client gets their needs met, and then this helps assure that data can be taken appropriately. So what we're going to move in now, I'm going to pass things over to Natalia and Carrie, and we're going to begin with the pros of Tele-ABA and service delivery.
So one of the pros of Tele-ABA is the service delivery. What we found is a study out of the University of Iowa found that costs decreased from $6,000 for in-person face-to-face services to about $2,100 when the families use the telebehavioral health rather than the in-person treatments. What we also learned is that the travel time is infrequent. Not having the travel time for the therapist or the family allows for additional time in sessions. It also allows the families to schedule around their own schedule and determine what best fits in their life. Also, programs can be tailored to the client the same way they would be in a home setting. What we found is that the sessions run as normal for the most part, and that the therapists are able to watch the children or individuals in an appropriate manner, and they are able to interact with the parents prior and after to get even better treatments.
Now we'll shift into the cons of Tele-ABA service delivery.
I had my microphone muted. Sorry about that. So some of the cons of the service delivery are mainly due to the startup costs with using teleconferencing to deliver services. So in terms of confidentiality, there are HIPAA compliant services that are available, but these servers tend to be very expensive and pricey, and they usually depend on the company's size. When we're doing, like one-to-one service delivery and setting up families to receive Tele-ABA services, they also need to be thinking about the startup costs for the technology. So they are going to need internet that is at a high enough speed in relation to the services they're getting. So you might be able to use lower speed internet for just teleconferencing for consultation and meetings, but if you're observing behaviors or doing any kind of supervision, you are going to want higher speed internet, which is going to be more costly. The same goes with the web camera and phone use. All of these are additional costs that may be quite large in the beginning and may make it difficult for families to start using Tele-ABA because of the initial costs.
The next pro we're going to talk about is the transfer of information. What we found is that Tele-ABA helps with the distance between the individual and the provider. The individuals can have services in their own home, and the individuals who are not able can go to a nearby clinic. A lot of places where there is not a large population, sometimes the drive time is approximately an hour or more, and this cuts down on that travel time. The cost for the services and the impact on their family is quite a bit lower than the in-person services, as we talked about before, thousands and thousands of dollars. That allows more people to get those services, especially for those individuals who are paying out of pocket versus insurance coverage, or who don't have very good insurance that will cover much of the services. Another pro is that individuals often have medical needs that prevent them from going into the community, or even prevent them from going into the community freely. If they were to go to a clinic or a hospital therapist appointment, things like that, they could pick up viruses, colds, different things that would impact their health and ultimately cost the family more money.
So some of the cons of the transfer of information, mainly the provider doesn't have face-to-face and hands-on contact with the individual. This is a problem when it comes to implementing procedures and training individuals on how to use procedures. So when they are, in some of the studies we've read about, one of the main things cited as a setback of using Tele-ABA for training purposes was that the trainer, the BCBA who was doing the training, couldn't step in and model procedures and interventions in the moment and give those people who are in training that hands-on experience and learning the feel of how the behavior intervention is supposed to be implemented. Again, the initial startup costs may be too expensive for a family to purchase. And then also when we're thinking about the HIPAA compliant servers, if those are too expensive, the families are also, they're going to have to purchase some kind of anti-spyware malware for their internet to protect against confidentiality issues. And one of the setbacks with this is that these can be installed not adequately. And then as behavior analysts, we need to be asking ourselves, by using Tele-ABA, are we increasing the risk of breaching confidentiality and creating a situation where confidentiality may be at risk? The individuals that are receiving Tele-ABA services may still be required to leave the home to receive services. This is specifically in regard, it's in regard to many things, but one of the main setbacks is for assessment purposes. It's been found that assessment should really be done in person through in-person observation. When we're observing individuals and performing assessments through Tele-ABA, there's a lot of subtle socio-communicative behaviors that we might not be able to pick up on through teleconferencing that are also very important to having adequate assessments. And then again, the individuals and families may not feel that their information is as secure through Tele-ABA because of those risks to confidentiality when using internet to transfer information and video conferencing.
The next part we're going to discuss is the outcome for the parents. What we found reading our studies is that parents developed an increased understanding of and confidence when they were implementing the interventions for their children. They had a better understanding of going from point A to point B, how it was going to work out. The parents were given the option of how to receive the treatment. They received online trainings. And what we were finding is the parents enjoyed the greater flexibility and the opportunities to meet and consult with the licensed professionals. It reduced their anxiety. They didn't have the anxiety from rushing from point A to point B for appointments. They didn't have the anxiety of trying to get their children in the vehicle when there were increased behaviors. And parents also found that they improved their relations with the therapist.
Oh, I see. Sorry, I didn't see my slide up. Okay, so some of the cons for the outcomes for parents. Technical difficulties themselves can add to parental stress. One of the studies that we read about, which was training families that were in very rural areas where there were no service providers, and so the parents had to be the main interventionists. They, in this study, the parents had actually developed relationships with the therapist in person during an face-to-face clinical trial that was held in a clinic that wasn't that far away. And so they already had a working relationship with the therapist, and what two of the mothers cited was that their lack of experience with using the computer was a barrier, and it was also seemed to be a source of embarrassment. And they said that if they hadn't had that relationship that had been built face-to-face with the therapist, that they would have likely quit the study. So they would have just ended using Tele-ABA because it was too stressful for them. One of the other cons is that without the in-person modeling of procedures, parents may feel overwhelmed by implementing some of the procedures. And one of the main problems with this, not only does this contribute to their anxiety and feeling like they don't have somebody there in person to help guide them through learning these procedures in person, you might also see parents following through on intervention plans because of how overwhelming it may be and their lack of experience, and then this in turn may be shaping up higher magnitude problem behaviors because they're not implementing procedures appropriately or they're not following through. One of the other studies that we looked at actually looked at training parents to be main interventionists in an early intervention plan, early intervention programming. And this was in-home and in-person. And with parents who were being trained in-home and in-person and taking a more active role in the intervention, they found that a lot of the parents, or a portion of the parents, the parent-to-parent relationship suffered because the parents were spending more time implementing procedures and focus on programming, and therefore having less quality time together. So this is something that Tele-ABA and research would really need to address, how we can support parents in terms of these different stressors they may experience, whether it's with technical difficulties, implementing procedures and following through on them, or just making sure that they have enough of that quality time there.
The next pro we're going to talk about is the efficacy of treatment. The studies that we researched depicted that using the telepractice to deliver the services has similar results to those in the in-home therapy studies. And then according to the Applied Behavior Analysis edu.org, a study was conducted with parents that used a self-directed online training program. And over time, they learned a lot of skills. They saw growth in their child. They saw improvements in behaviors, and they really enjoyed the way that things were going.
Some of the cons of the efficacy of treatment. So one of the pros of using in-home ABA is that the staff can be easily monitored when they come into the home. And this is more difficult when using Tele-ABA, especially when the parents are the main service providers. We can't always be monitoring them during therapy sessions. There's also less of a risk of unethical treatment as the staff are trained to understand what their role is and how to work with the client when we're using in-home ABA as opposed to Tele-ABA. One of the main cons with Tele-ABA also is that Tele-ABA doesn't really have very much research behind it. It's still relatively new. So as behavior analysts, we're not sure if you can say with confidence that Tele-ABA is an effective treatment without that very strong research base. There really needs to be more research for Tele-ABA before I think we can say that it's an effective treatment. One of the other things that we talk about with efficacy of treatment is the ability to assess the environment and make sure that the environment is conducive to generalization of skills and maintenance of skills. And assessing the environment is something that should really be done in person, according to some of the studies that we've read. So that way you can see all of the factors in the environment, some of which you might not be able to pick up on through teleconferencing. So if we're not able to effectively assess the environment through Tele-ABA, we can't necessarily say with certainty that the treatment that we're providing is effective through Tele-ABA as well.
And the next code we're going to address is referring back to 2.06, maintaining confidentiality. And we're going to refer to as what steps can Tele-ABA take to ensure confidentiality for the clients and families. As CDVR use HIPAA-compliant video conferencing, as we've discussed before.
Some of the ways in which Tele-ABA at the moment kind of falls short of maintaining confidentiality or really hasn't worked out all of the kinks in regards to that is when using a webcam, it can be considered less personal, but one of the biggest concerns is ensuring that the staff and even the parents are streaming from secure locations. So we want to make sure that when we're using teleconferencing, if we're in a clinic setting and teleconferencing to a parent in their home, that there aren't people in the room who aren't directly involved in the case. Also, in terms of confidentiality, when we're thinking about doing public outings and creating interventions and programming for public outings, using Tele-ABA may also create some conflicts with confidentiality as well there.
Now the pros of treatment intervention and efficacy.
I'm still seeing the maintaining confidentiality slide.
Oh. Any better?
No.
Oh, there it is. There you go.
Okay.
Next, we're going to talk about the treatment and intervention efficacy. One of the concerns we identified was how Tele-ABA could be an effective treatment and how it can be insured. And what we talked about and found in our studies is that the therapist could meet with the families at least once a week to find out how the client is progressing. Also, if possible, the behavior analyst could meet with the family at least once a month to be able to work a one-to-one ratio with the child and perform any assessments that may be needed at that time. With Tele-ABA, there's a lot of information that's being received. The sessions are recorded, so the therapist is able to go back and review those sessions time and time again to maybe pick up on things that they lost or didn't catch the first couple of times around. And we think that is definitely important for developing the most effective plan. There's also parent training on how to correctly take data. That is one of our concerns with the Tele-ABA is maintaining the appropriate data to get the appropriate intervention. And the studies that we were researching, the online training seemed to work great for those parents, and we definitely think that there needs to be further training to ensure that we are getting the right intervention into place.
And some of the ways in which Tele-ABA falls short of us maybe being able to say with confidence that it is a treatment that's effective, or a way to deliver services that is effective, is that there just isn't the scientific evidence backing it up as much as there is for in-home based services. It's really lacking in research that replicates findings or expands on limitations of previous research, or looks at different populations in different settings. One of the other setbacks is that staff trained to take data are more likely to take it accurately, more accurately than parents who may have other distractors in the home, such as multiple children. So when parents are the main interventionists and we're also asking them to be the primary data collector, we may find that some of their data isn't exactly isn't accurate because they may have distractors and they may be missing certain things that they should be observing and really be giving their full attention to. More of the sessions can be conducted with staff in the home when we're talking about in-home ABA in terms of designated times to help create a schedule for the clients. Also, when we're talking about programming and making effective treatments, we also need to make sure that we are delegating responsibilities to people that have the education and training to implement these procedures effectively. So if we're thinking about parents who might have limited knowledge in ABA, we need to be thinking about training them as well. But if we're creating programming at the level that they're they're knowledgeable of procedures, it really does limit what we can program for through Tele-ABA.
What we found is that Tele-ABA is a newer practice. A lot of insurance companies right now see Tele-ABA as an experimental service or an experimental treatment, so they are very reluctant to cover the services. What we find is that oftentimes they have to request a prior approval or go through a series of meetings with the insurance company to justify the need for this service.
And what we're going to move into now is 2.01, which is accepting clients. Behavior, like we mentioned before, behavior analysts should only accept clients whose needs commensurate with the behavior analyst, such as education, training, expertise, available resources, and organizational policies. If a behavior analyst feels like they can't provide these to the clients, consultations with a behavior analyst whose credentials permit performing such functions is needed before they work with the client.
So as far as accepting clients, the pro is considering the time and those clients that live in remote areas, especially where there are large drive times, people live in very rural areas. Tele-ABA may be the only service available. What we often find is in the rural areas, there are very few BCBAs, if at all, and clients, when they do find them, end up on wait lists, and some of those wait lists are pretty lengthy. BCBAs are limited on their time often, and they may not be able to take that hour or two out of their day to drive each way to and from appointments. So the Tele-ABA would solve that travel time. And then Tele-ABA could be argued to ensure that the code is upheld, especially for those behavior analysts serving clients in those remote locations. Tele-ABA offers the training, consultation, supervision, everything all in one package at a distance. We definitely want to make sure that our clients are getting the services that they want and request in an appropriate manner. And the reduced cost is definitely a bonus to that for the families.
Some of the cons with accepting clients, BCBA serving clients from a distance via telecommunication, they may lack the resource of a team of individuals that have the necessary training and experience to implement programming and interventions. So here we're thinking of a team of individuals who have the appropriate amount of training as a resource of a BCBA. Further research in the effectiveness of training individuals to implement ABA procedures is needed before we can consider Tele-ABA an effective way for clients to receive services. A lot of times Tele-ABA is being used for areas in which there aren't certified professionals who are educated in Tele-ABA or just in ABA, providing ABA services. And in terms of training individuals and teams to serve these clients in these distant areas, the level that Tele-ABA has been shown to train individuals isn't at the same level that In-Home-ABA offers at this time. So we could argue that a team, the resource of having a team of well-trained individuals to implement procedures is not necessarily something that a BCBA might have, specifically in these areas in which there aren't very many certified or trained professionals in the field of ABA. So Tele-ABA really does need to look into how to increase the effectiveness of their training procedures of individuals in these areas.
The next part we're going to talk about is 2.07, the maintaining the records. Behavior analysts have the information in their hand. What we find with Tele-ABA is that there are very few places the information could be out. That includes the therapist information, the client's home, and then by chance, if the individual has to go to a clinic, that information would be with that clinic. To maintain those records, we request, of course, securing documents in a locked filing cabinet when they're not in use, not leaving them out on your desk for other individuals to see. Utilizing online information, we found that using encryption, password protection, different services that provide that enhanced security when sending documents to and fro, and especially those videos that are going back and forth for the sessions. The next one is shredding and destroying hard copies after the retention period has passed. We don't want information just thrown in the trash. We want to make sure that we are HIPAA compliant. And then also being aware of who is in the session, who is around when the services are being provided. And in the home, it's usually pretty easy. The parents and the individuals know who is in their home at that time. And then also for the therapist on the other end, they know who is in their office. So that is an increased security.
Some of the cons of maintaining records for Tele-ABA is that the data can be breached in the family home, in the provider's office, in the analyst's office, or via the internet. There's a lot more risks to providing services online because the communication can be intercepted. And also there just needs to be extra mindfulness in password encrypting files that are being sent online and things like that, and making sure that the family is very aware of these things too. And we need to be mindful that the family is being trained in securing the information as well. The data collected by the family members and other providers may not be accurate or up to date, which can cause potential errors in treatment. And this goes back to what we talked about with efficacy of treatment, especially when there's multiple members in the family or multiple children. We may see errors in data collection more frequently than we would when providing services with a team of therapists using in-home ABA. So here we're talking about behavior analytic assessment and some of the cons. We found some research that specifically talked about some of the limitations to using Tele-ABA, especially in training and especially in training others to conduct assessments. One of them by Ashburner, Bickerstaff, and Copley talked about that one of the main difficulties in doing assessment through Tele-ABA and teleconferencing is that because ASD is such a social condition, there's a lot of nonverbal cues and communication behaviors that are difficult to capture when observing through teleconferencing and are very important to the assessment process. In a study by Al-Namari et al. In 2005, this study looked at training individuals that were in a different country. They were in Iran. And so they looked to training these individuals in conducting functional analysis. And the 4 individuals who were trained did have backgrounds in special education, but they didn't have backgrounds in ABA service provision. And only one of the individuals mastered all 4 conditions of the functional analysis and in implementing them. So they had a demand condition, they had an ignore condition, they had a play condition, and then they had their control condition. So the one that did master all 4 of the conditions, they later found in follow-up that this mastery of implementing these conditions in a functional analysis wasn't maintained. Overall, for all 4 of the participants, the most difficult condition to train through Tele-ABA was the demand condition because it required least to most prompting procedures. And this is, again, just highlights one of the setbacks of Tele-ABA is that you don't have that in-person component when it comes to training. So when, as a trainee, when you're implementing procedures, you really do want the person who is the professional there that's training you to be able to step in and show you in person how to implement certain procedures, especially behavioral intervention procedures.
The next section we're going to talk about is 4.09, using the least restrictive. What we found is that parents who were educated were able to use the least restrictive intervention possible, and it also improved how families recorded what procedures and the data on how to get to those procedures and interventions were used. We did find that many families preferred the Tele-ABA just because of the flexibility, and it did allow the parents to not have to go through some of those behaviors, especially in vehicles and things like that, going to and from appointments, going to the therapist's office, the clinic, whatever it may be.
So some of the questions that we asked ourselves in regards to least restrictive procedures in Tele-ABA is, how can it be ensured that parents are using the least restrictive procedures, and should parents be required to take classes before conducting ABA? So this ties back to Tele-ABA's limitation of observing how things are implemented. A lot of things can be missed when you're observing through video conferencing. And also that there just isn't really the research to support Tele-ABA as being an effective way to provide training specifically to parents who may not be aware of what the benefit of using least restrictive procedures are and how to use them. So it really is, it's harder to train individuals outside of homes to work with families. Also, when we're talking about, or when we're thinking about least restrictive procedures, we can also think about this in terms of the environment. With in-home ABA, usually you have a lot of environmental opportunities for implementing procedures, and you're not usually stuck in just one room. So you can move around, and you can program for this and for transitional periods and things like that. Whereas through video conferencing, being able to move around as the practitioner and then being able to observe as the BCBA, observing the practitioner implementing the procedures, there's a lot of limitations with using teleconferencing. So even though you could have a laptop with video capabilities for the therapist or the parent who's implementing the procedures, for them to have to carry around this laptop while they're transitioning with the client, can then make it so that they can't conduct certain procedures while they're in transitional periods, or they might not, the person who's observing might not be able to pick up on things that are going on through those transitional periods. So we could think of Tele-ABA as restricting the environment, because it's going to be best conducted if the camera is stationary and it is just conducted in one room, as opposed to in-home ABA.
The next section we're going to talk about is 5.03, the supervisory delegation. Some of the pros we found are that the supervisors can complete weekly follow-up with their supervisees. They can check in, they can review data, they can review the video recordings, any information to determine what is the appropriate intervention and how to move forward. The Tele-ABA does allow for the video monitoring and recording, and the supervisor can review those sessions as often as they need to ensure that their supervisee is making the appropriate recommendation.
So some of the cons of supervisory delegation, the services provided may be outside of the scope of the individuals and analysts working with the individual. So this really goes back to working within your capacity and your resources. And then that there just isn't as much research on training individuals and supervising them as there is with in-home ABA. So because Tele-ABA is using video conferencing and it is done at a distance, there really needs to be more research on how to effectively delegate responsibilities through Tele-ABA and train individuals to be able to work with these responsibilities and make sure that we're not having individuals practice outside of their scope of education and experience.
The next section we're going to talk about is 5.04, Designing Effective Supervision and Training. In our studies, we found that the behavior analysts can provide clear written descriptions of the purpose, requirements, criteria, conditions, and terms of how the supervision is going to work prior to the supervision starting. This is really important for families to know what kind of treatment they're going to get, how they're going to get there, and the potential outcomes of the treatment after the intervention has been in play.
So one of the main cons of designing effective supervision and training is that the programs and interventions are not demonstrated in person, and the supervisors are unable to give in-the-moment hands-on modeling procedures to supervisees. So in some of the studies that we read, the one where they trained the individuals to conduct functional analyses, and especially the demand condition being the most difficult one to train, we really see in that paper, in that study, that not having somebody there in person to role play with in the moment or to intervene in the moment and then demonstrate how certain things are done can really hinder the effectiveness of training. And also that it may just be that the training has to go on for much longer than it would when it's conducted in person, such as when providing in-home ABA services.
And in conclusion, we made a teacher involving the pros of Tele-ABA and then the pros of in-home services. The pros of Tele-ABA are that it's more cost-effective. So in rural areas can be provided. There's less time spent on travel. And the results can be similar to in-home services. On the in-home side, it's easier to train staff and keep track of data. There's less risk of technical difficulties such as internet failure. Assessments can be planned easier, and training staff can be done in the home. And then our next teacher involves different services in general. So for cons of Tele-ABA, there's lack of research to support it. There's great startup costs. There's a greater risk to breaking confidentiality. There's potential connectivity issues, limitations to assessment, and limitations to programs or programming. The cons in-home are it's less flexible to families. It can be more costly. It's less private because there's individuals coming in and out of one's home each day. And there can be limitations based on location. And then these are our resources. And now what we're going to go into is our personal experiences. So I don't have any personal experience with Tele-ABA. However, I've seen how it could be useful. For example, there's individuals that my company provides that have moved towards the outskirts of the area. It's extremely hard for those individuals to get line staff into their homes due to the distance, and this can become very frustrating to the parents because they're getting the services they need and the amount of time required for them to really start improving more.
I would say I don't have very much experience with Tele-ABA other than I've had sessions with clients that have been video recorded and then reviewed with my supervisor, and that's been very helpful. So Tele-ABA does offer, being able to record sessions and then review back, and that can help with training individuals because that's been very beneficial for me in my training. I've also had supervision meetings through teleconferencing, which I found to be pretty much just as effective as in-person meetings. And it's been great when, my supervisor's schedule and my schedule is really busy one week and we're not able to meet, then we can meet later at night. So it really does offer flexibility in meeting times. I would say that without that in-person meeting, though, I feel like I might not feel as though it's as effective. I would say that even though I argued for the cons of Tele-ABA, though, I really do feel that it is something that needs more research because it can be so beneficial. I mean, I really do think that with the studies that we've read, where there's, large populations of children with ASD who aren't receiving services whatsoever, Tele-ABA is a way that services can be reached to these individuals.
I don't have a lot of experience with Tele-ABA either. I would say that I could see it being beneficial, especially in the area where I live. There are very few resources for individuals with autism spectrum disorders and other developmental disorders. So I could see where bringing in a Tele-ABA service would be beneficial. They would have access to some programming rather than none. And then another benefit that I could see is that I have seen therapies take place where the therapist is not fluent in the language that the individual needs, and they can incorporate a third-party service to translate and provide additional supports for the individuals. And I could see where in Tele-ABA it would be much easier to bring that in versus having somebody there on the phone for an in-home service translation.
Mm-hmm.
And I believe that concludes our debate on Tele-ABA versus in-home ABA. Thank you for watching.